And next we have another non-native speaker, but it's always a pleasure to welcome Irina to come to speak to us. Our next speaker is Irina Gareba, and she's going to... have you wondered how we came up with this title? Well, I don't know that Irina will know any better than we do, but anyway, it's a great pleasure to welcome Irina Gareba from Moscow. She's going to speak to us from Russia with, yes, pus, forming a bond without a money penny. Irina, welcome.
Dear colleagues, dear David and George, thank you very much indeed for inviting me. This is my second talk on the DFCon. I think the first one was maybe 7 or 8 years ago. And to tell the truth, when first I've got this title, I thought, okay, it's something about the money and maybe low expenses, low income, something like that. And only when I started preparing, so my friend, philologist, she has a husband, and she told me, it's a secretary of bond. Okay, I told, I have to read maybe the book or might be to see the movie. So thank you very much indeed. Now I know because I read the film twice, but unfortunately I did not read Fleming is an origin. It will be occur after my coming back. Well, so from Russia with pus. And, sorry, it's a little bit... Okay. So many years gone after my first visit, and so now we have good news. We have got objectives. And because we have some statistic, it is our... Sorry. How should I go ahead? Well, we have got the National Register about the complications and the diabetes in Russia. And now we know exactly about the percentage of the diabetes in our country, about the... What's that? Maybe somebody will help me. Okay. And we know exactly, it's in the slides, in the slides movie. Well, should I push it persistently, or what should I do? Please. Okay. Oh. It's really... What should I do?
Elementary money penny.
Yes, please.
This is our mission if we choose to accept it.
Okay.
Next, yeah.
Okay. It's a tricky. Well, so we have got the Russian register on the diabetes mellitus. It's quite a big federal work has been done. And we know exactly about the proportion of diabetes mellitus now. And we know exactly how many complications we have in Russia. So we know exactly that diabetic foot ulcers suffer around from 2 persons for type 2 and for 5 persons in type 1 diabetes mellitus. But we know exactly that all these figures is underestimated. Well, and thank you, that's fine. And now we are moving ahead, and recently last year, the Diabetic Food Project started in our country. It's also a beginning of the work. And you see that there's 5 regions of Russia included. So the endocrinologists, surgeons, and podiatrists participated. And our center is in Moscow region. And so we have quite big active surgeons and podiatrists which are collaborated in one region. You see Voronezhskaya region, please welcome, it's not so far from Moscow, maybe 500 kilometers to the south. And we have got the first previous data that mean duration of stay in hospital is 19 for diabetic foot patients, and mean events is around 1.8. Yeah. So this is a patient characteristic, I was amazed to see that glycated hemoglobin in this quite complicated group of patients is around 7.7 and quite low LDL proteins, and so you can see GFR. But the major issue that in this particularly group which was analyzed, it was predominantly type 2, and you see it was predominantly narrow ischemic foot, as it was characterized by the participant. Might be it can be explained, but widely spreading techniques of ultrasounds, Doppler, and imaging methodologies. So here you can see which methods and the first results of the treatments. It mainly in hospital patients which have been hospitalized in those 5 regions. So the conservative methods favored for those patients, and different types of dressing was applied, and thanks our Cubanian friends, and we were invited to get knowledge about the product. And now epidermal growth factor already registered in Russia, and these are first experienced, and you can see that part of the wounded and ulcerated people got growth factor treatment with quite good results. And vacuum assisted closure is also implemented, but not very widely, but quite in different districts of Russia. So in particular, these 500 of people, 500 of patients, surgical methods was quite widely implemented, and the majority was amputation, but fortunately on the toe level, and quite a few, it was the amputation above knee. And to tell the truth, that I am very happy to say that also revascularization approach is coming close to patient beings, and the majority is endovascular with stenting or without stenting. Well, reading, okay, seeing the movie, I just stopped on the 25th minute to realize that it's a very nice sentence. And Bond and Christopher Attinger maybe sometimes, and Robert Freiberg, while visiting Russia, St. Petersburg, told, "Darling Moneypenny, I have never even looked at other women. Let me tell you the secret of the world." And I'd like to say that Russia got this secret and try to implement this secret thanks our American colleague and other colleagues who helps us a lot. And here are the next heroes of our stories. This is ordinary surgical department in one of the Moscow city center. So this is the chief of the PAS surgical department, the colleague, and Irina, who after getting some surgical secrets decided to be educated as a surgeon by herself a little bit. Then we decided to implement plastic surgery, and in particular in that department, it is quite ordinary, I'd like to tell, but advanced department. It is Moscow City Hospital. You can see that a lot of plastic surgery procedures is possible to implement, and in majority it was local tissues and local skin graft and distal skin graft, split skin grafts and combined procedures, and in several cases distant flap. We called it in Russia, I don't know why, Italian plastica. Italian plastica. Well, so this is a result of that treatment. In this surgical department of City Hospital, the narrow ischemic lesions predominated, and both ulcers and gangrene, half and a half. On dialysis was 5% of patients. And you see a lot of technique which was implemented, both revascularization, vacuum assistant, advanced dressing, endovascular, plastic surgery. And the results, it is just post-delivering results. The amputations has been fulfilled only in 13% of patients. It's not so bad, I think. So this is the case which was courteously delivered from this surgical department. So this case is you can see this is plastic surgery with tissues of utile toe, and we use the laser Doppler intraoperative technique to measure the microcirculation with a good healing results. Negative pressure wound treatment is also quite widely applying in this particularly hospital, and it helps according to the standards and to improve healing rate and to improve skin plastic surgery result, and quite a few cases of complications and low clinical effect in only five people. So this is a case which is done quite routinely on the base of this particularly surgical department. It's tibial arteries revascularization and NPWT. Here you can see the bilateral post-operative wounds with distant skin-fascial flap, 3 steps, quite complicated cases, which has done in this clinic. I'm a little bit afraid of moving ahead. This is a combination of angioplasty of tibial arteries and combined plastic surgeries, combined local tissues and distant grafts with a good effect. And the second part of my talk is called forming a bond without money. Without money and without penny. Of course, we try to calculate our expenses and really imagine that this is no magic bandages. So the next study, it was a prospective study made by Oleg Udovichenko, famous person in our diabetic food community, on the outpatient clinic. He compared the results of foam dressing, biotin foams, and aid dressing, and finally the results that it was quite equal in the median duration of healing. And so really we used quite simple dressing, non-adherent dressing, sometimes foam dressing, and sometimes expensive growth factor, but it's under the process of the finishing the economic calculations now. Then we have some bad news. that resistant microflora is also increasing in our patients, in particularly polyresistant species on the outpatient clinic and MRSA. And the last histogram showed that the percentage of MRSA increased up till 75% in those who has been hospitalized recently during last 6 months. So it's really a problem in our country also and in our clinic. It doesn't move ahead. So the revascularization procedure coming more and more available and even possible for many people, for many diabetic patients, for which is treated on the outpatient basis. So this is a clinical example. So 3 months after transluminal angioplasty and stenting, and before it was quite critical ischemia in this particular patient. And so this is also a small prospective study which is conducted by the same authors. So this is results of how many patients have been sent to vascular surgeons in the southwest Moscow district. So you can see, so this is histogram, and the patient who has been undergone revascularization. The angioplasty predominant, and the results was, of course, better for those who has been after revascularization procedures. So they healed in 60% of patients, and in comparison to those who has been under conservative treatment. Of course, this result must be analyzed only in combination with all comprehensive food care and offloading and shoes, etc. It is quite difficult to fulfill on the outpatient basis, but we try not to forget about the rehabilitation. And now patients move to rehabilitation clinic on the base of rehabilitation center I am working. And this is the case of quite severe bilateral Charcot patient type 1 who lives in, not in Moscow, in one of the Russian cities. And you can see this is one foot already partially gone. It is Chopart with ankle with Achilles contraction, and the other leg, other foot is also disaster, is a disaster. And after an unsuccessful conservative treatment, patient has been undergone to exostosectomy, and then incision, ulcer incision, plastics with local tissues and primary closure. And so this case finished in a favorable way. And the treatment has been undergone during a year. Patient was twice hospitalized, and so this is quite comprehensive. Shoes for indoors and for outdoors has been produced with special prosthesis. Now we pay much more attention for those who comes to rehabilitation unit after plastic surgery, because it is the most difficult patients for making shoes and for wearing shoes, and we have to pay a lot of attention, and it's quite cost a lot of these shoes have to cost a lot, and the price of these shoes is only partly reimbursed by our country. And of course we try to help with these people off-shelf shoes, and it's possible to buy different well-quality shoes in Russia, and we help with adaptation of the shoes and with trying to do multi-layer insoles with very thoroughly checked together with a shoemaker by ourselves to follow these patients very thoroughly. Of course, these shoes have to cost a lot, and I told that it's not possible to cover by state, and of course, patients have to pay a little bit by their own money to cover all the cost of these quite expensive shoes. But we work on these problems also to improve the law. We have federal law which was issued 10 years, quite 20 years ago in Russia on social defense of people with disabilities, when 2 pairs of shoes and insole a year have to be produced free of charge, and only education and podiatry and shoes, all these 3 points together, is possible to decrease the number of amputation in our country. But shoes is important, but we sometimes can win without shoes. This is our Olympic champions in the Olympic Games. Well, education. This is the last issue, and it's of course is very, very important. And we, like many of you, organize postgraduate course for diabetic foot. Very interactive, with some plays, movies, some sketches, which make this for long memory for those who come for this postgraduate course. And of course, I'd like to say thank you very much for all those people, for our mentors who helped our country. And we organized several symposiums, and this is our first symposium on the diabetic foot. So Professor Bolton delivering a lecture, which is memorial for us, which any patient with a plantar ulcer who walks into the clinic without a limb must have neuropathy. This is the start of our education, like international courses in Russia. We organized 4 international diabetic foot courses, and here is one of the last courses, which has held in St. Petersburg 2 years ago, on the 26th of May, on my birthday, and Karl Becker comes, and our Czech guests come, Professor Alexandra Jurovsky and Solomon Tosfey and Robert Freiberg, and we had quite a good course and implemented the additional material for our international consensus for the diabetic foot. But time goes on, and really not an easy life, and I'd like to thank Andrew very much indeed, because during such a tough schedule, he finds the time and comes to Russia last month to our 7th Russia Diabetics Congress, which was held in Moscow. And you can see here my mentor, Professor Amatov, and Professor Bolton, and my colleagues. And behind you can see the Kremlin wall. And our gratitude to postgraduate committee of ESD. They helped a lot to educate Russian young doctors. It's always a great success, these postgraduate courses in clinical diabetes for ESD, and this is the 3rd course, which has held last year in Yekaterinburg. The city is between of Asia and Europe, and we are planning the next course in Novosibirsk in the middle of Siberia. Please welcome. Finally, I'd like to finish because once I visited Florida and read the words of Walt Disney, let's stop talking and start doing. That's why. Thank you very much indeed.
Oh, Irina, that was terrific. You even foiled the decadent Western plot to annex your mouse up there, too. So that was just